Okay, so as you can see over there, I just wrote the sixth step that pretty much I take all the time and on every ECG. The first thing I would like you to notice, this is where MI is. A lot of people read the 12 leads and they go straight to, oh my God, is there an MI? The second thing is do those steps all the time. Here's the reason why. Even if you see something weird, do those steps. Because, and I'll tell a personal experience, when I started in emergency, one time a paramedic brought me a patient and showed me this ECG, and oh my God, there was ST elevation and stuff. Yeah, the patient was in left bundle branch, but I rushing him to the resuscitation room, call a doctor and everything. It was a left bundle branch. Well, left bundle branch is not much you can tell anyway, so this patient was not having the big MI. Could be a good MI, but it didn't need to be rushed in somewhere. So don't. And as you do those more often, so every ECG you do that step, you can literally read an ECG in a minute or two. And all those steps will be done. Obviously at the beginning, you need to remember the steps, you need to remember the logic of it and stuff, so it'll take a little bit longer. But truly, if you do that on a regular basis, a minute or two, and your eyes will basically be scanning all that stuff, and you'll get way more information. You'll see why I'm talking about all this, because at the end of those 6 steps, you'll truly have a good information, and you'll pull out even more information out of your 12 lead than just MI, non-MI. And this is an important part of it as well. So always do those 6 steps. They're easy to remember. Obviously there's stuff, I'll mention them, I'll explain a little bit the physiology of them, but you need to go and read on that. If you don't know exactly what the difference between a right bundle branch and left bundle branch, it's way too long on one video to explain what it is. Right ventricular enlargement, left arterial enlargement, or left ventricular hypertrophy, then it's way too long to explain all that stuff in it. So you need to understand that some of those concepts you'll need to go and read, but this is the steps that you need to apply. If you apply those steps all the time, you won't miss a thing. And even if you don't understand what the 12 lead is, you'll be able to give a good information, because it's not so much important to know that it's a secondary, third degree block with some PACs and stuff. It's just to be able to recognize that the heart is not pumping properly, and this can affect this, and because of this, then I wouldn't give that medication and stuff. So it's not so much to come out with the diagnostic and that long, that's why cardiologists are there, but it's more as from a nursing point of view, to be able to say, can that impact my patient? A good example of this, and once we'll see a little bit more, if you have a bundle branch, so you have a right bundle branch on your ECG, and then you have an IMI block on the other side. So that means that the left branch, and we'll talk about it as 2 branch, and one can be blocked. That means that this patient is 1 branch away from being in a total block. So it's a doctor would, and this is actually a true story. So if this patient, the doctor would ask you to give a medication like metoprolol or calcium channel blocker, I would recommend that you go back to the doctor and say, are you sure you want me to? Because what it's going to do, it's going to block it. And because he only has 1 branch going, you could literally close that and put this person in 3rd degree block. So this is the purpose of it. It's not to be cardiologists, it's not to come, but it's like, what I'm seeing right now in my picture affects my care of my patient, or will it affect the medication I'm about to give? So let's get into it. So we won't be talking much about it, but all the steps that you usually do to read the strips, so your PR interval, your P, your QRS, your side of your QRS, and everything. And then you come with your rate, so normal sinus rhythm and everything. And on 12 lead, the usual 12 lead that we have, not the EMS one, but a normal 12 lead, you're usually going to have a line of your of your lead 2 right below. So it gets easier and stuff, but always get your rate, because it will give you some idea as well as, because it's a little bit of a puzzle that you're doing. So you're going to gather a whole bunch of information, put them together, and try to get a big picture of something. So that's why rate is the first one. So we won't be talking much about it, but it's basically all the steps that you're supposed to do for a rate. The axis. So the axis is really interesting. It's a lot of people makes it kind of complicated, but I make it pretty easy, as all you need to know is that the electricity is not going the right way. So basically, what is the axis? So the best trick for reading, and there's tons of, again, if you're a cardiologist, you have to measure that way more precisely. But if you are just reading from a 12 lead, the easy way is to look at your lead 1 and AVF. If you remember in the last 2 videos, what we were talking about is that AVF will read your electricity going this way, and lead 1 will lead the electricity this way. Well, look what it does. It gives 4 quadrants. And what was rule number 2? Electricity that comes towards me will be, will be positive, away from me, negative. That's exactly what the axis is. So the trick for that, and you can choose the hands that you do, as long as you always do the same hand, so you can use your thumbs. And what you do is you go at lead 1, and let's say you've decided that lead 1 will always going to be your left hand, and AVF will always going to be your right hand. So what you do is you come to that, and you look at lead 1. Is it mostly positive, mostly negative? Mostly positive, thumbs up. AVF, mostly positive, mostly negative. Mostly positive, 2 thumbs up. So that means that you are in the normal quadrant. And what is the axis? And basically, all I always show it is, and again, I'm a nurse, not an artist, so sorry about this. It's basically what we call vectors. And what it means is that when the machine reads, it reads how much electricity goes somewhere, and do a vector, so do a calculation and check. And the best way that I can explain to it is the tug war of a rope. Obviously, your left ventricle is bigger than the right ventricle. So the left will always have more pull than the right. So our axis and the electricity that is going will all be more in between 0 and 90 degree. So you can have an axis of plus 45, plus 70, whatever, but as long as it's in here, it's in the normal. So this is pretty much what it is. But if, for whatever reason, let's say you have a big MI on the left side, because mostly your ECG, by the way, too, looks at left side, so that's why that if you have an inferior lead, you want to do a 15 lead, because you want to check on the right side if there's involvement, because the machine reads pretty much all the left side, not so much the right side. Reads it a little bit, but not much. So let's say I have an MI, and I lose those 2 puller. What's going to happen? I got 2 against 1. Instead of being more here now, it will go the other way, right? Well, this is what axis is that the vectors, so electricity, the axis will always go away from, will always go in the direction of where there's more electricity. So that means that if I don't have a lot of electricity on my left side, where would the vector will be? I'll have a right axis, because if I have an MI on the so if it's this my ventricles, and this is my right ventricle, and this is my left ventricle. And my left ventricle, the electricity, because this whole part here is dead, so that means there's no electricity going there. When I'm going to read my axis will read as, hey, there's more electricity here. It doesn't mean that there's more electricity there, it means that there's less electricity there. So my axis then will be a right axis. So that's where axis can help you. They can help you in MI, or to understand that why do I have more electricity going one way or the other, or some, so this is all it is. It's just telling you that electricity, it has changed its course, and then it push you to ask the question why. There's tons of ways that you can read PEs and stuff, but in my mind, when I'm asking, why is that electricity going the other way around? So if I have a right axis deviation, that means now my electricity, instead of going in this quadrant, it's going in this quadrant. Why? So then you can ask your questions and stuff. So that's what an axis is. So to get back to our trick, we got a so we got our lead 1, ADF. So the trick of the trade to remember all that is it's good to be up. So when they're both together, left apart, so left axis deviation, they're going to be like this. So lead 1 will be up, AVF will be away. Right together, or right axis deviation, that means that 1 will be down, AVF will be up, and they're right together. So, and no man's lands where both are negative. So basically, it's good to be up, so that means that's a normal axis. Left apart, so they're apart. Right together, that's a right axis deviation. And that's what basically is the trick for axis. And this is the reason of axis. Enlargement, where you're going to check is mostly lead 2 and V1. And pretty much for atrial enlargement, what you're going to look for is this in lead 2. You're going to see either this or something like this. And basically those means that the atrial enlargement, so this is right atrial enlargement and this is left atrial enlargement. In left atrial enlargement as well, your lead 1 will kind of look like this. So, let's put it a little bit more. So lead 2, like this for right atrial enlargement, and lead for left atrial enlargement. In lead 2, it will look like 2 little bumps, and in lead V1, it will look like this. And that is pretty much the best way of checking for that stuff. For ventricular enlargement, basically it's left ventricle or hypertrophy, and basically what you're going to do is you're going to take the R of the 2 biggest R, and you're going to addition them, and if you get more than 35, and there's different protocol. But basically what you want to check is that is there hypertrophy of either the atrial enlargement or of the ventricles. And again, read on those, you'll know a little bit more about, but basically that's where you need to check over here. The branch block. So there's a right bundle branch, left bundle branch, but also there's any blocks. And it's over here that too, you're going to check those. And this is a little bit where your axis helps you as well. So you want to check if your branch block, if a right bundle branch, a left bundle branch. So you can have an incomplete right bundle branch or a right bundle branch. You can have a left bundle branch or an IMI block on the left side. So that's what you want to read for those. MI is only here, and this is the typical thing. You want to check about the ST elevations and others. On number 6 here, this is where you're going to get a lot of information, and I'll put like 2 articles on that one. Electrolyte. The most important electrolyte that you can see on the 12 lead is hyperkalemia. So you want to check that one out for sure. PR, sometime PR interval can be elevated or have be under. and that's another one you want to check. AVR and QT.